Welcome to Interop Workshop, everyone. This is for those of you that have been here before, you know it, but I'll say it again anyway. This is a technical discussion of the exchange of healthcare data with the goal of facilitating interoperability overall. And as I mentioned a moment ago, we start on time and we end on time because we respect your time. I will tell you here right now, and I stand by it because I say it every time, this is the most fun hour you can possibly have and still be talking about healthcare data exchange. I stand by it, and I challenge people to prove me wrong on that one, because it is that topic. Anyway, I'm the host of this. My name is Jim Benson. I'm the CEO of Zen Healthcare IT, and with us here, as always, is our resident expert. We call him Mr. Wilson. Sometimes we call him the Ron. Sometimes we call him the Chump. But he hasn't actually been stumped yet officially, so he's batting 1,000. So I wish one of you would bring a question that will stump him, please, because we'll never get his head through the door if it continues to go like this. Ron is the VP of Interoperability and Architecture here, and as the solution architect of the vast majority of Zen's product suite. And for those of you that have worked with him before, you know exactly why. Today we have a special guest whom we had before, but we've asked him to come again here and join us, Derek Wayland, who's the VP of IT and Security for Zen. And you'll see why in just a couple of minutes. In addition, you'll see Karen Flatus, who is our new director of marketing, and she's going to be handling some of Jessica's normal duties while Jessica is out, but we're glad to have her along with us, and great that you're here. Some housekeeping as we get started. For those of you who always are here, you know about these things, but this is a real world discussion on interoperability challenges. It is not a marketing a thing for Zen, although I will from time to time make a shameless plug. You would expect nothing less from me, but we do invite clients, we invite prospects, we invite vendors, and even competitors to join the discussion. So do not hesitate. It is an interactive session. You all have your microphones on. We encourage you to turn on your cameras, even though you might be looking in the side of somebody's head. It doesn't matter. We do it all the time anyway. And we invite you and encourage you to ask questions. I reserve the right to ask you questions too. So be ready to turn your microphone on if you do turn it off, because you never know when, I'll jump up and ask you a question. We do ask you to turn on the chat as well. We'll be posting things in the chat room there overall that you might want to copy and get information from. This is also a wonderful opportunity for you to say hi. There are people here that you may want to know in the future or get to know, because this rising tide lifts all boats, and if we all participate in this interoperability thing that we're doing here, it makes us all smarter, and we encourage everybody to do this. This particular episode is being brought to you by the First Amendment, that allows us to actually have discussions like this and do say whatever we want to. And it's also being sponsored by Zen's Fire to CCDA transformation services. If you need to translate between Fire and CCDA, please don't try to recreate it yourself. Reach out. You can put CCDA or Fire in the chat if you want us to get more information. We'll be glad to get that to you, but that's who's sponsoring it today. And we've worked hard on putting that service together, and I hope that you'll take advantage of that. All right, almost the last thing, and we will get down to the meat and potatoes of this, as Ron appropriately says. The recap of previous sessions. We've actually been doing this now for the better part, almost 2 years, maybe even a tad more than 2 years. I can't remember. And we have quite a few sessions that are out there. There is we have published those on YouTube for you to watch again. And I'm sure that we've got a summary of them as well Karen will post the link to the YouTube sessions out there. Don't hesitate to check that out when you get a couple of minutes of surfing. It's better than surfing some of the other nonsense that's out there, and you'll probably learn something because there's a lot of good stuff there, and we encourage you to do that. All right. With that, all that's the housekeeping stuff. We actually have a new segment that we're doing starting in this one, and I have affectionately called it, until we come up with a better name for it, Interoptics. Get interoperability and optic. Get it? Okay. Anyway, Interoptics is the title of it. It is Interoptics in the news, and it is the segment of what we're doing here that is what's going on in the marketplace today. Because we do plan these things and we try to get topics from clients that we have and all kinds of different stuff. By the way, if you have a topic that you'd like us to touch on, please put it in the chat. We'd love to have that and focus in on things that are relevant to you. So don't be bashful with regard to that. But this is the segment where we say, what is the latest stuff that's happened this week or last week that you want to be aware of? And so that you can stop listening to me drone on. This one, the first topic that we got here is the Commonwealth Conference, which Mr. Wilson got back from just yesterday evening, as a matter of fact, and was one of the panelists that was out there at the summit. Ron, take the microphone from me for a minute here and give us the 411 on what happened at Commonwealth Summit 25.
Well, one full day and a half day, lots of new things happening. Very, very compact conference in Indianapolis. The Commonwealth Fall Summit is an interesting group of folks. It's mostly competitors, to be frank with you, in many ways, but we work together as a collaborative team. It's a different construct than other industry kind of meetings. A couple key things that came out of it. CMS is moving forward with another directory of organizations based on fire. And this directory is going to be focused on healthcare providers and services. This was announced about a year ago and has been followed up and moving forward. A couple of key things that we're monitoring and watching is provider-based or entity-based IAL2 and or AAL2 validation, very similar to the IAS use case, where rather than just individual validation or verification, we will now validate, verify providers and potentially entities. And some of the discussions that were going around that were related to delegation of authority vetting, as an example, how to simplify delegation of authority vetting and onboarding for that use case. Another one that was interesting is trying to correlate at some point, we've all been begging for this, providers to facilities or organizations. How could we follow the data trail between Dr. Bob and community hospital and practice ABC? So that's kind of the hope of that directory. In that discussion about directories, which if you're aware, Zen manages 5 directories in an Excel spreadsheet that augments 2 of the directories. It's quite the mess, to be frank with you. We have spent a lot of time and effort on this. So, of course, my first response was, why are we adding another directory? What came out of that, though, from the Sequoia project management team was a coming team to do conformance validation, both semantic and syntactic conformance, which I fully applaud, and so do others in the industry. Post some follow-up questions I had in an after-hours session with some folks. They were all like, finally, we're going to get the help and support we need with this, which is good news. The other key takeaway that of the day, or the terms, was geofencing. Geofencing is a bad word in the national networks. They don't like the idea. They think it's not very efficient. And what is telling is the stories on how they're actually implementing it. And for many of our customers, they have asked me this question: well, we just want to do it by zip code. That's how everyone else is doing it, and it's proving to be very problematic. And how they do it, many of them, is they do a three-digit prefix of the zip code. I did some analysis this morning on that just for my own personal home location, and that would leave out all of Tennessee, all of Alabama, all of Arkansas, and those are all within 100 mile serviceable distance from my home here. So that is the big problem. They're missing data, especially in rural communities where travel for services, healthcare services, is pretty common. Zen, as many of you are aware, Zen does not do zip-based geofencing. We do a actual pin and a radius, so we can try to encompass those gaps in those boundary layers and those types of things. Um, that led to primarily the MPI discussion, of course, at Commonwealth and record locator services, two distinctly different things, but outlining the benefits of such and the expansion. A couple interesting numbers in the Commonwealth EMPI: 465 million references to persons. Of that, 220 million distinct persons is in their MPI, to give you some perspective of how large that is and how fast it's growing with the care quality bridge and collecting those correlations between care quality and TEFCA providers and, of course, the Commonwealth network itself. I didn't realize they had that much growth in that arena and it was that big. So that was really big news in my mind. Um, Again, I mentioned the organizational validation, directory conformance. In a nutshell, that was kind of the interesting announcements. And then I was on a panel talking about fast fire UDAP implementation and brokered fire. So why do broker fire? What is brokered fire? And it's a pretty involved discussion and rather interesting. But fast fire UDAP is a new security model implementation that has been balloted, voted on, and just recently had a connectathon on. And it steps away from the smart on fire blue button and implements a SSL certificate pattern that would support the revocation for a bad actor, as an example,
Oh.
which can be problematic with common certificate usage and other things. So, lots more come there on that. Lot deeper discussions in the future here.
Fantastic. And we're going to, I'd actually like a show of hands here. We're talking about having some new guests, fire specialists, interest in having, because normally we do guests. We've gotten big enough to be able to do that. Is that a subject that most people would like us to do? Put a yes or a no in the chat, if you will, to help us vote on doing that. One of those that we're going to see if we can get is a guy that you were on the panel with, Ron. Tell us a little about him.
Yeah, so Jason Voigt, sorry. Jason Voigt is very active in the fast fire UDAP work group. He was instrumental in helping define the IG and testing and development, and he is the development manager at Meditech. And Meditech is fairly committed um, to implementing fire and discrete fire data exchange, right? So, the interest there is, there are folks in the marketplace that don't need an aggregate CCDA type of document volume back from somebody. They want encounters, they want medication lists, they want a problem list, they want a patient care team, as an example. Very specific things, not a whole aggregate CCDA concept or bundle of data sets. And we all know that the CMS ATSP has required fire-based data exchange for certified technology. Today, we're mirroring or mimicking the traditional document-based exchange with fire constructs. And the goal is to get away from that and get more to discrete data, pulling together exactly what you need and why you need it for the time frame you need it, not necessarily just getting back what an endpoint will provide. Um, So Jason's an expert in this arena. He's spent a lot of time on the UDAP certificate-based data exchange, and has a very interesting take on brokered fire. And so I think if we bring him in, he's willing to do it. I think it would be a good discussion to have with folks about the reasons brokered fire might be problematic. Are they good? Are they bad? Where are the pitfalls, and what are the benefits of brokered fire, right? I truly think there's benefits to brokered fire, but we'll see.
Yeah. Well, and one of the purposes of that we're doing this, and hopefully the reasons why you folks are showing up and spending an hour with us, is to make sure that you're familiar with the kind of things that are coming down the pike, so you can make informed decisions as well. One that I will do a quick follow-up on, in addition to what Ron was just talking about, is the definition of treatment, and from a HIPAA standpoint. And as you heard from Liz last month that we did this, she brought up and talked a little bit about how the definition of treatment under HIPAA is really obsolete, because it centers around those that are paying for it directly, and there are lots of use cases where that doesn't necessarily apply. That is gaining additional speed. I will tell you that while this is third hand here, Marilee was talking with Ryan Howells of Levitt Partners here at the Commonwealth meeting as well, and there is more and more discussion that's gaining ground, where the definition of treatment will be changing in all likelihood, and we'll keep abreast of that, and try to keep you posted as to what's going on and what the effects of that are. I did tell Marilee that we were going to jump on and see if we could get Ryan Howells here, and she told me that I couldn't do that because he's going to be they're going to work on scheduling that for Marilee's office hours. So here's your shameless plug. If you haven't already plugged into Marilee's office hours, please do that, and or let us know that you'd like us to give you the information on that. She covers a lot of stuff that is not necessarily technical, but is stuff that you should know in this realm. So anyway, if you want to get that information from us on her office hours, please do so. It's an hour that's well spent. It's slightly different than what we do, but it's well spent. All right. With all of that done, we finished that in 18 minutes, and you're still with us, which is a great thing. We're going to get into interop chaos. It's a recurring theme that we find around here, just by the nature of what we do. And chaos is opportunity. So it's an opportunity for you to be knowledgeable of what's going on in it, why it is a problem, and how to best fix it. Whether it is doing it yourself, DIY as they say, doing it with a partner, or you don't have a partner, you're looking for one, what questions should you be asking about the partners that you have? Regardless of any one of those three scenarios, if you're informed and you know the questions to ask, you get a much better result. And that's what we all want to do in that regard. So without further ado here, we've kind of combed the service desk tickets that we have coming through here, and we're getting more and more information from those. Thankfully, we don't have a lot, but that's that notwithstanding, we do have certainly do have some. And the topics that we came up here was, and one of the reasons why Derek is here, is connectivity overall, and how that is changing with new technologies, and how legacy stuff is causing certainly some problems. We'll get into that in a minute. Delegation of authority. We've talked about that before in the national networks. It is an area that we're finding that a lot of people really don't understand what is it, and why is it doing what it is doing. But as you'll hear from some of the numbers, and you just heard from some of the numbers that Ron just mentioned, it is a big deal, and others in the marketplace are taking advantage of it. So it's one that you really want to be familiar with. We'll give you some more details on that in just a moment. And national network directory management. Ron touched on one of those things, one of those characteristics here, but he'll cover a little bit more detail on how it directly affects you in your national network, and of course TEFCA going all how it can bite you from time to time as well. So first, without further ado on that, connectivity, and that's Derek and our resident. Uh, what are you? You're the VP and all kinds of cool stuff that we've got here. Let's talk about best practices and those the things that we want to do. There it is. I lost it. It is VP and IT security and our resident CISSP. I was drawing a blank on the CISSP. I don't know why, but I did. Legacy connections, all that other neat stuff. Derek, talk to us a little bit about what you're seeing in legacy stuff, what you're seeing in the newer stuff, what causes problems depending on who you're connecting to, firewalls, all that other neat stuff. I'll open it up to you for a few moments to just kind of give us the 411 of where you see it.
Sure. Well, there's not many ways to get connected in a secure manner. There's a VPN, a site-to-site VPN that you can get connected, or you can get connected over the public internet using HTTPS. And what the industry has leveraged mostly in the past, especially with HL7 V2 messages, they've leveraged site-to-site VPNs pretty extensively. And that has worked and has been a solid implementation for a long time. But as we want to become more scalable and we want to guard, uh, Zen wants to guard our internal network more and more, we are electing to go towards the public HTTPS route more and more and trying to adopt more modern authentication mechanisms with that, such as like the OAuth, the JWT workflow. Um, Site-to-site VPNs, in my experience, if you it really depends on the teams that are setting up the site-to-site VPNs. If you've got good teams on both ends with non-conflicting network security policies, then the VPNs can come online in 2 seconds and there are no issues. You never have to take a look at them again. But come any sort of migration that Zen wants to do at a later date, we really have to manage those VPN connections individually. So it locks us up when we want to make improvements in our own network infrastructure. So some of the issues that we encounter a lot of the time with site-to-site VPNs is conflicting network security policies. Um, Zen is very protective of the private IP space. We make use a lot of automated network solutions. So in our site-to-site VPNs, we have a requirement that you must NAT to an arbitrary public IP because in our infrastructure, there will be no network overlaps. And I've encountered a lot of pushback associated to that um, due to teams just not understanding how like VPN connections really work on the low layer or just a network policy situation. So when you encounter two conflicting network policies, somebody has to budge, and that means uh, if somebody has to budge. That means you have to add exceptions to your network policy. That means you have to add tracking. It can delay onboarding. So what I've seen a lot more success with is going towards the public HTTPS method. Um, the healthcare information networks have been utilizing MTLS. That's the SSL certificate authentication mechanism in order to secure traffic in between the networks, and that has been a really good solution thus far. However, I've noticed that a lot of point-to-point connections try to rely on that. And that is adding more concern to me for the healthcare space, leveraging MTLS as a standard authentication mechanism, because in the SSL marketplace, they are going towards shorter and shorter public certificates, which means that anytime that instead of renewing your certificates and doing public certificate exchanges once a year, I am foreseeing that they're going to start making it so it's once every 3 months. Now, the healthcare information networks are shielded from that because they leverage a company called Direct Trust, and they can set up their own certificate authority rules to protect against that. But in terms of all of the other connections, I think that we need to start as from the healthcare marketplace viewpoint, start looking at migrating to the more modern approaches with short-lived tokens, OAuth, JWT workflows. It really enables just more nimble implementations, and it allows us to also uh, implement those JWT solutions with resources that aren't necessarily as expensive as a network engineer. So somebody who's familiar with the application stack can stand up authentication workflows as opposed to getting two network engineers on the phone to finalize a VPN connection, which even that can be challenging. Network engineers are hard to get on the phone.
Yeah. So would you say that even though there's probably a good number of folks on the call here that have done it the traditional way for a long time, and they're probably scratching their head a little bit, going, why is this such a fire? It is what I'm hearing is it is a bit of be careful to continue to put straws on that pile, because there are things coming down the pike that will affect things like you were talking about with certificate durations and managing those as you grow, that you may want to start looking at the traditional and start changing what the tradition is.
Absolutely. And even leaning on the MTLS side of things with well-known certificate authorities, anybody can go get a certificate from DigiCert. So your implementation team who's adding those certificates to your trust store to enable MTLS, they better know what they're doing so that they're not just granting anyone with a DigiCert certificate access to your endpoints. So that's just like another thing that I believe is not a lot of focus is not put on that in terms of certificate exchange with well-known certificate authorities. Once again, that's different for the healthcare networks or the healthcare information networks like eHealth Exchange and Carry Quality, because they use Direct Trust as their certificate authority. And you
Right.
must get a cert from them. And the only way to do that is go through their onboarding process. So it's a lot more secure in terms of who gets a certificate for the MTLS authentication mechanism.
Mhm. I also got the topic down here. Oh, by the way, before we go on, any questions with regard to that? Does that make sense to everybody, or are you scratching your head a little bit and going, why are they focusing in on this? I don't understand.
I'm just feeling bad about the ticket I'm about to log in the next couple days for a VPN update.
No, there are lots of them out there, and we've got a lot of them as well. But it is an area that we continue to look at and go, we got to streamline this. We got to make it easy for people. And a lot of our clients, they've got their clients. Some are extraordinarily sophisticated. Others are clients. You've got people that simply aren't sophisticated and have done it, a hard way, but they know how to do it for a long time, and it makes people kind of go, well, we just don't want to change anything. Well, like most of the things that we talk about on this, the world is changing on you anyway, and continuing to do things the old way is sometimes not the best. I'm going to put Derek on the spot here a little bit. I'm always looking for different ways to provide services. And while Marilee has formal office hours, I'm going to consider the idea of having Derek reserve an hour on his schedule once a week or once every 2 weeks to just be available for office hours that not charged. Anybody can jump on an open call and say, "Hey, Derek, I got a question about." Would that be something that the rest of you folks would like to have? Just knowing that there's an expert out there that you can call and go, "Okay, how are you solving this kind of problem thing?" Anybody?
I mean, I feel like I kind of get that anyway as a Zen client.
Well, that is true. Although they are supposed to be charging for such things, sometimes that
Yeah.
doesn't happen. But anyway, we may look at doing that because there are so many things that are changing, and we want people to be informed. So while everybody's being very quiet and got their microphones turned off and their cameras not on, we know that you're out here, and you might have an opinion on that. Put something in the Slack, let us know, because we'd like to make that available. Lastly, before we spend too much time on this, there were questions that I had, Derek, about the public cloud and some difficulties in natting in the general public cloud overall that we don't normally use on our day-to-day. Touch base on that and give a high level of the
Sure.
problems that you're seeing.
Uh, I have seen some complications when clients have utilized the native VPN solutions that are available in AWS or Google, and they have a particular limitation on when you can NAT, and that's related to presenting a public IP in a VPN proposal. It goes back to what I was saying before about avoiding network overlaps when you stand up a VPN connection. Unfortunately, with the cloud provider native solutions, they do not support NATing in their policy-based VPN connections, which is basically all of the VPN connections that that I've stood up at Zen have been policy-based VPN connections. That means that clients have had to stand up their own virtual firewalls in order to get those features related to that public natting. And then on top of that, because now they're paying extra fees for the virtual firewall, but any sort of egress traffic that's going out of these cloud providers, that traffic gets charged. And that's kind of hard to determine and budget, especially with national networks. And if you have traffic going through VPN tunnels, you have no idea when the feds will just all of a sudden query for every person in the United States on a Monday. And now your bill is through the roof. So it's just some of the things that we at Zen wanted to avoid. So we have our own firewall solution that we utilize that gives us all these features and functions out of the box. Um, yeah, cloud native VPN solutions are it's surprising that they don't have that functionality. And then they also have another item associated to it where they will get connected to any VPN connection using whatever lowest encryption settings work. So if you set up a VPN connection on, we use a Sophos firewall. So on my Sophos firewall, if I set up a VPN connection with insecure settings, it's going to warn me and say, whoa, that's insecure. If I were to go establish that VPN connection with AWS, for example, by default, they just try to establish with whatever proposal the other side generates. And I've seen insecure VPN connections get stood up that way in the past. Uh, Easier to catch on vendor firewalls than the cloud native solutions.
That's a big deal. They will connect at the most minimally secure connection that they can.
Whatever match. So whatever the other firewall sends in the VPN proposal, it will match it. So if a data source sets up their firewall to have insecure settings, AWS is just, oh, cool, it works. and it's going to be kind of hidden from you. It's been a bit since I've worked with the public cloud native solutions. That is what it was a couple months ago. I doubt it's changed, but it could have.
You never know, but that's a big deal. That's a gotcha that you should be keeping in the back of your mind as you're doing it. And like I mentioned just a moment ago, okay, you make the secure connection. Oh, okay, now it works. You never think about it again. Think about it. It is important and very valuable for you to know and understand. And if you don't do this stuff on a normal day-to-day basis, virtually impossible to keep up with. Avail yourself of somebody who knows if you don't know yourself. Please, it is in your best interest to do so, whether it's Zen or anybody else. Just make sure that you're doing that. I want to take just one other quick second here and talk about something that came up with a client call just the other day, because we were talking AWS, we're talking about different folks that you do vendors with, and the client was talking about vendor lock and then what they'd experienced in previous that they didn't necessarily want to commit to any one particular vendor. They wanted to have AWS do this. And it was really interesting to ultimately have the follow-up discussion with regard to that really vendor lock is not something that you can avoid, folks. It's if you're that in that particular scenario, it's very easy for everybody to go, oh yeah, well, you don't want to go with XYZ company. We'll just do it with AWS because we control. You just locked into AWS and their characteristics, just like Derek was just talking about. It is a big deal. It's no different than if you selected Jira for your ticketing system that's there. We happen to not use it. We actually got off of it and use ClickUp. ClickUp's much better. Shameless plug there. But anyway, if you connect with and start using one of them, well, you just vendor locked into them too, because if anybody's tried to change your ticketing system and know what it's like to do that, that's pretty tough. So it isn't a matter of vendor lock. It's my opinion here. It isn't a matter of the vendor lock. It is a matter of how comfortable are you with the vendor that they will be there and they know what they're talking about and you know what to expect from them, both in terms of risk, reward, costs, details, all of those things. So I would suggest to you that the next time you hear somebody talk about or you think about vendor lock, go, no, that's not really the question you should be asking. It is more of those details that I just mentioned. I think it's an important characteristic that you should consider. Anyway, it's my opinion. I will just throw it out there. You guys can come off mute and throw things at me if you think I'm wrong on that. Throw something in the chat, what have you. Love to have the discussion on it, but that's worth everything that you paid for it. But I think it is valuable myself. All right. Any feedback on that or what Derek was talking about? We'll pause. If not, we'll change topics. 3, 2, here we go. Delegation of authority and the national networks. This is the second topic that we've got that we find that for the most part, people either really haven't heard of at all, or if they've heard of it, they really don't understand what's going on with it. And it's an area that is changing dramatically right now and is going to continue to change as we go forward. And again, the national networks it is a big deal right now because we're going to be having the IAS use case really kick off in earnest January 1, which is right around the corner. So a lot of the characteristics of the demands on the network are going to change, and virtually all of the health tech vendors who don't, they want to get data, but they don't have the ability to respond. Somebody else responds on them. The vendor is getting data on behalf of an EMR or a clinic that is using an EMR or what have you. Ron will touch on this in more detail, but the delegation of authority is their ability to get that data, knowing that someone else will respond on as required by the networks overall. So Ron, I've teed that up. I may have teed it up poorly for you, but I'm going to throw it to you and let you give a little bit more of a technical definition. But what's the definition and the use case of delegation of authority, and why is it relevant to this group?
So 2 years ago, 3 years ago, the 21st Century Cures Act put into legislation a requirement for health tech certified technology must support the individual's right to acquire their own data and consume that and do what they will with it. They could give it to another practitioner, they could load it into a wearable device. So if something happened, a facility would have it handy. They could literally do whatever they wanted to with it. It was their discretion. And as part of that, delegation of authority starts to become operational in allocating or allowing entities, health tech vendors typically, to represent a facility or a connection that's already in the national network and query the network on behalf of or as a delegate of that particular facility. So let's talk a little bit about, and this isn't relegated specifically to IAS, but it's one of the large areas that entities are potentially going to use this for. And it's a very strong purpose to do that. There are many others. One would be AI companies that are going to provide specialty treatment evaluation and planning for a particular ontology within the hospital, cardiology, cancer, all of it. And they have an LLM that's just loaded up to the gills, very brainiac solution that can help clinicians in that department provide better care. And that system is not adding to the clinical data or augmenting the clinical data. It is digesting and consuming and producing internal recommendations back to the care team. A couple of definitions, actors that are in the scheme of delegation of authority. There is a delegate, an initiator-only participant. This is a member of a network, whether it's Care Quality, TEFCA, eHealth Exchange, doesn't matter, that is not going to respond with patient data. They are only going to initiate transactions, consume data, and talk to the principal or the connection behind the scenes, meaning they're going to deliver whatever the derived product is from the delegate in a manner that doesn't require national data exchange. An implementer is an entity, typically EHR vendors for the 80 percentile groups. Zen's a little bit different. We're an implementer, but we're not an EHR. We're an enabler of folks to get on the networks, both responding and non-responding. And an implementer of technology is who manages a principal connection relative to the network. So, delegation of authority says this delegate, ABC AI, is going to be present on the network for this connection or principal, ABC, Main Street Hospital, and there needs to be an enablement of that delegate to empower them to query through a business process called vetting. Vetting is done with a delegation notice. This is an official form that collects information that is provided from the delegate and the principal with very specific details that is given to the implementer with signatories on it, delegate signatory, principal signatory, that says, Mr. Implementer, I'm a connection, a principal, and I want this delegate to represent me on the network for these services and these transaction types and so on. As such, the implementer now manages the directory entry for the principal to create a correlation or reference to a delegate. So the implementer says, okay, we're signing off on the vetting process. We're going to allow this to occur, meaning ABC AI can now query for Main Street Hospital to provide the services that Main Street AI does, and they will update the principal connections directory entry to say there is a delegate connection between Main Street Hospital and ABC AI. A given principal can have many delegates for various reasons. You could think of there being a delegate potentially for every specialty or every group in the hospital system, very likely, because the LLMs need to be more refined than broad, frankly. And a particular technology may want to have a custom patient health record, a portal, right? Everyone's got there's a couple terms that also came out of Commonwealth, portalitis, right? Which I just found hilarious. But there was a statistic mentioned, the average US citizen over their lifetime has 70 portals, 70, with potentially 20 to 30 that are active. I found that just mind-boggling. So just, those are all credentials that have to be managed.
Right.
So one of the requirements in this vetting process with this delegation notice, is the implementer has work to do rather than the delegate or the principal. So we're dependent on the implementer to do work. Well, what's come out in Commonwealth Group was some very interesting real world practice of vetting and posting and updating principal entries to record a delegate enablement. The requirement from CMS says that an implementer shall take, must take, not shall, must take no less than 5 business days to do the vetting and to implement the principal connection entry update to represent a delegate reference, or return it back to the principal and the delegate for a rejection. Meaning an implementer can say, this is not a valid delegate. They are not X, they are not Y. And there are many reasons for that. They're not doing IAS, they're trying to do TEFCA treatment, they're not a covered entity, therefore they can't query for you, on and on and on. Many reasons. Whether they're valid or not, they can get rejected, and then there's a conversation that ensues. There's no real communication time frame on that conversation after it's rejected. It's not rejected in that 5 days. They're supposed to get that posted within 1 day after the acceptance. So a total of 6 days is what the window looks like right now. I got a report from another implementer that is not a technology, an EHR. They're very similar to Zen. They're kind of frenemies in a sense. 6 weeks to get a delegate entry updated. Another large scale implementer, which happened, both of these were EHRs that were the target implementers to deal with. Another one has 40 staff now, and on average, it's taking 2 weeks to go through the vetting process and to get the entries updated. So what that tells us is it's not scalable. And that's why we're seeing all of these other things being talked about on how to streamline that validation in that vetting process. And this is now what we're working on right now today. I have to have wrapped up as an implementer, testing with 5 other implementers by Friday for delegation of authority technical changes relative to messaging. This technical change is fairly innocuous. We're adding a SAML attribute that creates the correlation between the delegate and the principal as a reference, so that the provenance can be recorded on why is ABC AI querying us and who are they connected with. So that is the ongoing work that's done. There is also, of course, directory implementation changes because there are new fields, what's called a DOA extension that goes on the directory entry of the principal. So, what does that mean to everybody else? How can you leverage it? Well, many of our clients are health tech vendors. They
Mhm.
are attempting to add products and services to the larger, community at large, and for various reasons. So, I think a key takeaway here is one, having a good business process for the delegation notice, which Marilee has spent countless hours on, and the Care Quality Policy Work Group, working with our CX team, our product team, marketing team, in communicating this with clients and very trying to educate them to the extent that we have to. And then having very good working relationships with folks in the network. So those are two key takeaways on delegation. Where Zen is right now in the testing for care quality, we have two partners that we're actively still testing with, and neither of those partners are Zen's fault for the issues. One has still failed to post their directory entries to the care quality stage directory. Another had PTO staff and are scrambling and engaging today. Ron, please finish testing. Hurry, hurry, hurry. We don't want to ask for an extension. Others, and we've tested across test groups. There are 5 test groups. We are in test group 5. And we have tested across test groups to validate with the larger organizations that were not in our group. And we have been successful with those organizations and continue to do so for the next day or two. Okay. That gives you an update on that.
So, pop quiz for everybody. Pencils down. No, kidding you. We won't do a pop quiz, but I reserve the right to do so in the future. What should you walk away with this? Or why does this matter to me? Health tech vendors are a big part, and they're a growing part of our ecosystem. They're not going away. You need to know that they can and are entitled to get data across the national networks. And actually, it's in everybody's best interest for them to do so. And when you couple that with some of the other characteristics that Ron was talking about earlier, with the why am I drawing a blank here on it?
IAS?
No, it's the well, it's not the IAS use case, but it is the other protocol. I'm drawing a complete blank. I'm sorry.
Fire, you mean?
Fire.
Fire.
Thank you. And direct fire, and those kind of characteristics. It is important for you to be aware of it. You need to know it just from a basic standpoint, a delegate, a principal, and an implementer. And okay, how does that high level machine work? Because if you're on this call, chances are you're going to cross over with this again here before the end of the year, and you want to know something about it. It is important, and of course the testing is important there as well. You may or may not be able to leverage it today, but chances are, if you're familiar with what we're talking about here, it will give you a leg up here in the future. It is 53 minutes after the hour. We actually have a whole nother section that we can cover, but I also want to make sure that we talk about the Interop details for next month. It will be on the 29th of October overall, 1 o'clock, which is our normal time for doing it. We do have a special guest coming in for that one as well. Melissa Stoles is an attorney in the data privacy and interoperability space, a very well known and renowned one to overall. And we will be talking about consent management as well as other things, which is another pretty good sized deal that you'll want to be familiar with the IAS use case and other things coming on. Consent management is a real thing, and it's different. It is changing, like everything else in our marketplace. So, Karen, if you will, post that the registration for that, so that you can share that with others and yourself. If you post that in the chat, that would I'd appreciate that. Ron, do you want to take a swing at making just a 2 or 3 minute summary of the directories, or?
So lots of changes, lots of progression in the TEFCA directory. Jim mentioned IAS and January 1. That is a not necessarily technical implementation date. That is a real world usability implementation date, in my opinion. IAS is not required to be responded to in Commonwealth or Care Quality or eHealth Exchange networks natively. It is a TEFCA construct, and it is a Commonwealth internal network construct in the sense that 80% of the Commonwealth network supports patient request. And we are seeing large numbers of migrations of Epic facilities primarily at the moment. 80% of the Commonwealth network is on TEFCA, only 20% are not. And those 20%, unfortunately, fall into a problem statement on mandated TEFCA treatment definition around HIPAA that Jim mentioned. They fall outside of the covered entity scope, so they can't participate necessarily, or are opting not to at the moment until that gets some more resolution.
Right.
So we will see the ramp up of IAS and the directory usage largely explode, I think, in 2026, just due to the migration from Commonwealth to TEFCA for the larger health systems and Epic and Meditech and Greenway. As a result, Zen has been quietly behind the scenes working on some proof of concept work on Fire-based discrete data exchange. We are currently doing a POC for FastFire UDAP with some of the Commonwealth participants and others. We did not participate in the Connectathon at HL7. We have been busy planning our fall and winter show season, which we're going to be at Civitas in Anaheim Monday, Tuesday next week. Marilee and I Sunday, Monday, Tuesday, Wednesday next week. And we have successfully passed all 16 required responding test cases, and we are actively working on initiating, and that requires a little bit more coordination with partners to get their defined endpoints and some other things cooking. We do have our client certificate being issued by EMR Direct, and we will continue that testing and validation to be ready effectively for discrete fire data exchange and abstraction from Stargate API. So just the folks that are Stargate users know that you most likely won't change much in what you're doing. It will change behind the scenes from us to the world, not from the world to you. Okay, if that makes sense. Your payload will change in a DR retrieve, but the interaction with Zen will not. And I think in 1 minute, if I can just speak to Mel's provenance here, I think there's been a lot of questions on IAS and consent policy, data segmentation, which is a big discussion in many states. California is an example. Maryland, other states have data that cannot be shared anymore, shouldn't be shared anymore. And that we want to just give you guys the landscape and what it looks like if you're a data aggregator and how are you preparing for that. And I think she's going to be a good resource for everybody, both if you need some solution help, she can come in and help you with your consent, your forms, your application, data retrieval from patients, those types of things. And then what to know in your document generation or your return data that you're going to be shipping back. Okay.
Important stuff to be familiar with. We're trying to provide the service to give you insight into these various things. We do want to have more guests that are relevant to you. We got a great response back from having Liz from Commonwealth here last week. We asked her some tough questions. She handled them well, although she didn't stump the chump, and that's kind of disappointing, but she'll come back and do it again. We're looking forward to that. Melissa Stoles, also known as Mel, as Ron just referred to, is one that you won't want to miss, and come with some questions. It is important that everybody know of those things as it relates to you, because the world's changing and spinning very quickly here right now. If there are other topics that you would like us to do some homework on and and get relevant people in to do this. We're happy to do it. We're looking forward to doing it. If you've got a question on it, we've probably had that question as well, and we hope that you will give us that insight to what we can do to best serve you. As I always say, we start on time, we end on time. It is the top of the hour. We're going to end. We're grateful to have you join us. Hopefully, it is worthwhile, and we'll look forward to seeing you next month. Thank you all.